What I'm going to show you are the basics of how to use a goniometer. A goniometer is a fancy name for a device that helps measure the angles of degree, the amount of movement that patients go through during range of motion testing. That's what they're primarily used for. There's several different kinds you can get. Here's one. I actually got this online. It was probably no more than $6 or $7, $8 at most. Here's one I've had for many years. It's even a more basic model. This guy is just a metal goniometer that moves like this. So it doesn't really matter what kind you use. They're all the same principle. When you think about it, they're kind of like the protractors you sometimes use in trigonometry, or even kids use to draw semicircles, and of course you can measure angles with them. That's basically what a goniometer is. Now you might ask, why would you want to use a goniometer? I'm not going to get into a whole spiel about it here. I just want to show you how to use it. But real quickly, a few reasons. One, it looks very professional to use one because you're being more accurate in measuring when clients are doing range of motion testing, how far they can move. Some people say, well, I don't want to get into instrumentation, and that's kind of fancy, too fancy for me. I just want to eyeball it. That's all I need. Well, that's fine. There's no right or wrong way to do this. When you use a goniometer, however, you do get a more accurate measurement, of course, and you can document it. That's also important, especially in personal injury cases, cases involving insurance or litigation. It's always good to document it. And as far as your regular clients, when you accurately measure, they see your professionalism, they see the accuracy, then through subsequent sessions with them, you can compare and contrast the changes that they make. So you're measuring their progress. Now that's a whole other area of client management. I'm not going to get into that either now. How do you explain that to them, and how do you use it to measure, monitor, and manage their care for further recommendations? Anyway, let's reel it in. So I just want to show you how to use this. It's really pretty straightforward. I will tell you a key concept that very few people teach. And when I used to teach orthopedic assessment at the chiropractic college for a clinic entrance exam, a concept that people loved was, think of ranges of motion as there's 6 planes, of course, 6 basic planes. You could argue there's circumduction, but let's don't go there for now. 6 planes of motion. So one plane is flexion, say with the neck. You bring the neck forward like this, that's flexion. Coming back is extension. And of course there's rotation, and you go right, left, and then there's lateral flexion where you're tilting to the sides. So think of a jet aircraft, and the aircraft is flying along, and it has basically 6 planes of motion it could go through. One is the nose tilts down, which would be flexion. Another is the plane, the nose comes up and the back goes down, which in this case would be extension, and the plane could rotate or turn to the right. The plane could rotate or turn to the left. And of course the plane could tilt, in this case laterally flex to one side and laterally flex to another. So those are the basic planes of motion that you're measuring. Now here's a really cool concept. When you think of measuring range of motion, think of each particular direction that you're having a client go through as being a potential circle. So a circle has how many degrees to it? 360. So you're measuring how many degrees from the starting point the client can move in a theoretical circle that would go all the way around. So in other words, if, let's say, you start with them in this neutral position, and you want them to laterally tilt to the left. So if you tilt the head to the left like this, I'm going around in a circle, which if I could go all the way around, that would be 360 degrees. During rotation, if I turn this way, now I'm at about 45 degrees. A right angle would be 90 degrees, and if you could be like the old movie The Exorcist and turn all the way behind you, that would be 180 degrees, and a full circle would be 360. So you're measuring parts of the angle of a full circle. Think of it that way. So the goniometer, here it is. And you can see the measurements on there. So if you're starting for example, in a straight line, and then a patient were to tilt to the sides, and again, I'll show you how to do this in a moment on a actual client, and client, patient, whatever, they're just people we treat, so I interchange the words. So as they are tilting to the left, you would hold this behind them actually, and I'll hold it in front of me for now. And as they tilt to the left, you would measure the angle that they are laterally tilting, laterally flexing, and then you can see on the goniometer what that angle is, what that measurement is. And in this case, you can see that I went about 30 degrees. It's pretty simple, pretty straightforward. So again, if you hold it this way and they're rotating the head, say to the right, you would turn it as the head turns, and to the left, pretty straightforward. This way, as they're facing sideways, and then you measure how far the head goes forward, or if they extend back, how far the head goes backwards. And you just look at the numbers that it shows on the goniometer, and that's your angle of movement that the patient, client can go through.